Before we talk too much about vasopressors, let's talk about receptors and what gets activated when we use different medications in the ICU. My name is Leah, I've been an ICU nurse for 19 years, and today we're talking about the receptors that are affected by the different vasopressors that we use in the ICU. So let's start with our alpha receptors. So if you have a medication like phenylephrine, what it does is activate your alpha 1 receptors, and those are basically just going to change the size of the pipe of the blood vessels, and that vasoconstriction is going to increase your patient's SVR and increases your patient's blood pressure. Then we have medications like epinephrine that also have beta effects. So we'll talk mostly about beta 1, but there is also beta 2 effects. I always used to remember whenever I was in school that beta 1, there's one heart, so that's how it's beta 1 and what the effects are. And beta 2, there's two lungs, so that's how we know. So we might use an epinephrine drip that has these beta effects whenever we want the beta 2 effects if we have a patient that is in an anaphylactic shock. And if they're in anaphylactic shock, we would want to have those beta 2 effects. But for the most part in ICU, we want those beta 1 effects. And it's found when we use epinephrine at a low dose. And so the beta 1 effects that we're looking for affect the heart. It increases the heart rate and increases the contractility of the heart. Then we have our V1 and V2 receptors. So our V1 receptors, which are activated by medications like vasopressin, is going to cause vasoconstriction. And then our V2 effects are going to be water reabsorption. So whenever we're understanding medications that we use in the ICU, if we understand what receptors they affect, then we're going to understand the medications a lot more and how titrating them is going to affect our cardiac output, our cardiac index, our heart rate, and all those things so that we can be better bedside nurses. If this is helpful for you and you're new to ICU, whether you're a new grad nurse or whether you're an experienced nurse that's transitioning into ICU, I have an ICU Success Academy linked in my bio above. I'd love for you to join us inside.